bum 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 ba da da dum bum bum ba da ba ba dum rum bum 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 ba-dum bum 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 ba-da-da-dum bum bum ba-da-ba-ba-dum. I'm laughing because I'm reading some of these comments. Greetings, friends. Hugh and happy Labor Day, says Marty. So nice to see everyone. I love Monday, says Carrie. I do too, Carrie. It's nice to see you. Hello, my friends. It is Monday, and we do this every Monday. We do one thing and one thing only. We go after homeopathy. I teach you what I know. I share with you. And then you kind of intersect. You get to know each other as well, which is a really great thing. So my name is Joette Calabrese. And this is what I do every Monday night, for those of you who don't know me. And if you don't know about homeopathy, this is a great place to start. But for those of you who do know me, hi, friends. Irene from Montreal. Hello, everyone. Hi, Natalie. Natalie's with me tonight. I keep freezing up. Okay, Monday. Kristen from Japan. Hi, good evening, morning here from Japan. Hi. Hi, Donna says, hi, greetings from Jersey Shore. Hello to all. Hi, Elizabeth from Pennsylvania. Robin. Yes, we like each other, Robin declares. It's true. We do. Alice from sunny Toronto. It is sunny. It's a beautiful day in Ontario, isn't it? Thomas says, good evening from Tom and Jan and San Juan Capistrano, California. Hello, everyone. Hello from Oakville, Ontario. Lot of Canadians. Love to see my Canadian friends. Kim from Catonsville, Maryland. And let's see where else we've got people. Good morning from Western Australia. Hi, Tara. You're here every day, every Monday. Howdy, Joette. Love you too, Elizabeth. Hi, from Authentic Health. I know Elizabeth well. She's in my mastery classes. It's really Dolly from Pennsylvania. Jody from Central New York. Hi from Michigan, says Laura. And there we go. Nina from Maine. Wonderful. From Colorado comes Brenda. Wonderful to see you all, friends. We're going to do something. We're going to work on a medicine tonight. It's such a fascinating remedy. It's particularly interesting because my prompt, which was dental pain, telling you that it's a rather unexpected medicine, is really true. Because what's fascinating about it is that we often think that if we have pain in our teeth or the area in the mouth, mandible, maxillary, the gums, etc., that means we need to get to an attorney, to a dentist, ASAP. It doesn't cross most people's minds that you could treat it homeopathically, potentially. I'm not saying that it's an absolute, but those of us who use homeopathy certainly know that it's worth a try, right? Isn't it worth trying a homeopathic medicine first before you commit to a dental chair, an x-ray? They don't do sonograms very often, but injections, general anesthesia, local anesthesia, pain, angst, etc. Yes, of course it makes sense. And I'm not saying, my friends, that you don't ever go to the dentist. I actually have a dentist who I like very much. I consider him a friend after all these years, who does not pressure me for a condition that I've had years ago. And I just go and he checks me out with a sonogram, it calls a cavitat. And he checks to see how my old dental infections are doing. And they are indeed old, unnecessarily concerning dental infections. They're now all gone. And I used strictly homeopathy, just homeopathy. Maybe my diet has something to do with it too, because I'm pretty careful about my diet. I'm not persnickety, but I am careful about it. So let's talk about this medicine today. I want to reiterate, friends, that when you feel pain, dental neuralgia, and I'm going to go to my repertory, and I'll start with the materia medica. And of course, this is Robin Murphy's Nature's Materia Medica. And this is the 3rd edition. I'm sorry, my 4th edition is not here. But when I look up this medicine, it's going to be surprising to you. You're not going to find an awful lot about dental pain. The medicine is Mezarium, Mezereum, Mezarium. Now, you probably were thinking hypericum, right? Or hypersulf, or hyperars, or something like that. No, it's Mezarium. And I learned this, I mean, certainly there it is in the repertoire. I'm going to show it to you in a minute. But I learned this from the Banerjees. They use Mezarium, and it's very interesting. I'm looking now at the materia medica, and under the clinical section, it says neuralgias. Yeah, dental pain can be a neuralgia, absolutely. Then when I look further into the, teeth affections. Affections of the teeth. Yes, Mezarium. Just two little entries. It's not talking about the widespread use of this medicine for dental pain. What it does talk about is Mezarium for skin conditions, psoriasis and eczema, especially on the scalp. Eczema or psoriasis that's like a glove. So it covers the hand, and then it stops right at the wrist. And also it's like a sock as well. So on the feet, there's eczema or psoriasis on the feet that's like a sock. That's what it's mostly known for. But how great that we can use it for something so completely different. Now, I'm going to the section. There is a section on teeth in Robin Murphy's Materia Medica. It says, teeth. Teeth feel dull and elongated. Teeth feel cold. Teeth painful on biting on them and from cold air. Now, I want to warn you. I want to remind you. Maybe it's not a warning. It's a reminder, my friends, of that when we use these medicines and we're looking up in the materia medica, you should not have, if you're thinking you have neuralgia of the teeth, you do not have to have each of these symptoms. If you did, oh my gosh, you'd be in rough shape. This is a list of symptoms that have been reported by homeopathic doctors through the centuries that include probably thousands, if not tens of thousands of people. Okay, so roughness from tartar on teeth, roots of teeth decay, rapid decay of hollow teeth. You don't need to have decay, though, to use this. Toothache into temples, yes. Just a toothache into the temples. Doesn't mean that it's infected. Doesn't mean that there's even a cavity. Toothache into the temples, better with mouth open and from drawing in air. So what you're looking for, my friends, if you're going to use this medicine or any of our medicines, do any of these, not all of these symptoms, do any of these symptoms ring true? Does it make sense for the case that you're working on? Toothache in gums from cold air. Toothache from congestion to head. Sensation as if the tooth was being lifted out of the socket. Now, I just finished telling you that you don't find an awful lot of information in this medicine, in the materia medica, on dental conditions. But that's a pretty decent amount. However, I do want to share this with you too. This is Roger Morrison's desktop guide. I like Roger Morrison very much. I know him personally because I've interviewed him for my academy, but I also have used his book for years. Now, under Mezarium, by the way, Mezarium is a type of a shrub. Where do we go here? There is nothing regarding dental pain. Now, that doesn't mean he gave us skimpy information. It doesn't mean that he was wrong in the way that he presented Mezarium, but Mezarium is noted for topical eczema in the antecubital flexor, which is the inside of the elbow, as well as the popliteal fossae, and that's behind the knee. So it's very common that we find eczema or psoriasis or eruptions, inflammations, etc. at those areas. But nowhere does he say dental pain. He does say headache and neuralgias. Neuralgias. Not headache and neuralgia, neuralgias. That means that he's talking about kind of a pain that is can be a kind of a nerve pain that could be anywhere in the body. So it's not as though he eliminated or skipped it altogether. He touched on it in a more broad way. So, let me just say parenthetically, because I think this is so fascinating. He does talk about generally worse, this is Roger Morrison, generally worse from suppressed skin eruptions, such as neuralgias, deafness, sciatica, asthma, anxiety, etc. I'm going to repeat that. Generally worse from suppressed skin eruptions. My friends, do you understand, those of you who have been following me for a while or are in my academy or have taken my courses, that when you suppress a skin eruption, it causes conditions that are much greater, more sobering later on? That is one of the great principles of homeopathy, that when we suppress symptoms, it causes trouble later on, and it's a more sobering condition. So, what is a suppressed skin eruption? Ointments on the skin for eczema, petroleum-based ointments, steroid ointments, creams of any kind. Allergy doesn't even have to be applied to the skin. It could simply be taken. Allergy medicines, over-the-counter and prescription drugs that keep the skin from itching. Fascinating. And what he's saying is that general worse from suppressed skin eruptions, such as neuralgia, what he's saying is that if there's a tooth that's painful, it could have potentially been caused by a skin eruption that was suppressed. A skin eruption that was. Now, what if you put olive oil on the skin? What if you put tallow or lard or butter without salt or something like that? That, my friend, is not suppression. What we're talking about is suppression from over-the-counter and prescription drugs. And from years ago, they used to use mercury. Yes, they did. And petroleum-based products. So, isn't that fascinating that in two things that are very interesting that he mentions, that Roger Morrison mentions in his desktop guide, and that is that it's worse. The need for this medicine is when we see an eruption of the skin that was suppressed, could have been decades ago. I'm not talking about suppressed yesterday and now you have a toothache. I'm talking about decades ago. And it can also cause deafness. You listen to the cases of the people who have deafness and find out if they ever had any skin eruptions that were in which a prescription or an over-the-counter drug was used. Fascinating. Well, and then he also goes into more specifically loss of hearing following suppressed eruptions. I realize we're not talking about that. We're talking about teeth. But it's still very interesting, and it's worth our discovery of this. So let's go back to Mezarium. Oh, let's go to this. Now I'm going to go to the repertory, and this is Robin Murphy's 4th edition of the Meta Repertory. And when I look up teeth, jaw, and teeth and jaw chapter, I'm looking under pain, and we have Mezarium is in there. But my friends, here it is. Mezarium is in there. I'm on page 1979 for those of you who have this book. There it is. Mezarium's in there, but it's not bold. It's not bold or underlined. It is italicized. So for that, and we can look through this repertory and go further and further. And this is what's also interesting. On page 1982, pain in healthy teeth. I'm on page 1982 on the right column. I would expect to see Mezarium. It's not there. So I'm not proving that these books and these authors and this collection of information is inadequate. I'm showing you that we need to go to more than one source if you really want the right information. Jennifer says, I'm amazed how much homeopathy dovetails with Chinese medicine, pathophysiology. Yeah, it's true. Because they're both real. That's why. Because these are the real medicines. That's why they dovetail. So it's beautiful. I'm glad you've noticed that. Okay, so now it does say, I do not see Mezarium in here for pain in healthy teeth. But I'm going to tell you, my friends, I think of Mezarium for exactly that. Pain in healthy teeth, or potentially healthy teeth. We think there's something wrong, and yet when we use Mezarium and it clears it, then we've just saved ourselves a lot of sorrow. What's the sorrow? Having a tooth extracted for no reason. I can't tell you the number of people who have come to me and said, this tooth hurts. Well, so what did the dentist say? Well, the dentist pulled this one and that one on both adjacent sides because it hurt there before, and before that it hurt here. So now 2 teeth have been pulled and the neuralgia is not gone. And now we're at the remaining tooth. And what many dentists have done in the past, hopefully not so much today, although I do believe that is part of what modern medicine is still encouraging, is they just pull the tooth. If it's painful, we got to get rid of it, right? But that's not so, my friends. We might need a medicine called Mezarium. Mezarium, Mezerum. Now, a lot of times I say, listen, my friends, before you choose a homeopathic medicine, you might want to make sure that it really does fit. And I'm going to tell you that always and forever. And what I mean by that is that I want you to go to your materia medicas and read up to make sure that it does fit. But with this one, there's a little twist. And the twist is we don't know if there's something wrong with that tooth. We do know that there's pain. And when there's pain in the tooth or teeth, or it could be many teeth, it doesn't have to be just one tooth, it could be many teeth, are sensitive to pain, to just cold air. Ooh, that hurts. Cold air, cold drinks, or it's related to headaches. It could be related in so many different ways. All we know is that there's pain of the tooth, and before we go we go to a dentist and have it checked out with invasive methods, Mezarium may be in order. Now, if there's a tooth that's infected, that could be a different story. Is it still worth treating with Mezarium? It may be worth it. But if a tooth is infected, it's time to probably have it. You're going to treat it homeopathically, and you may have to have it extracted, depending on the depth and breadth of the infection and where it resides. If we're talking about, the bone is infected, the root is infected, or is it just a boil, a gum boil? Now we have other medicines for that. And you'd go Joad Calabrese gum boil. Joad Calabrese, infected, let's see, how might you look that up? Because I've written articles about it. It's also on my blog, etc. Keep digging about, and you'll find lots of ways of looking at an infected tooth. Robin Murphy's Materia Medica has roots of teeth decay. If someone has a root canal that has another root of that tooth that has decay, might that be a remedy? If someone has a root canal that has another root of that tooth that has decay, I'm sorry, I don't understand, Jennifer. Just rewrite it. Just try it again. Do you like Hecla for tooth pain also? Yes, but I have to tell you what's fascinating about this would be my first choice, because this is for a neuralgic tooth, a tooth that's painful on touching, a tooth that's painful from coldness, etc. I have a discolored tooth, no pain. Dentist thinks tooth is dead and may need a root canal. Any thoughts on this? Well, it's hard to say. By discolored, I'm sure you mean black, not yellow or brown. We don't want, let me just start with this, we don't want to keep a tooth in the jaw, in the mandible, the maxillary. We do not want to keep a dead tooth there. That's my philosophy. That's the way I see it. Now, I'm not a dentist, I'm not a doctor, but we don't want a dead tooth because that's only going to cause trouble. Root canals, you might want to read the book Root Canal Cover-Up, written by probably I think he was the pioneer of endodontistry. That is the root canal specialty. You might want to read that book, Root Canal Cover-Up. Sounds like Mezarium is a remedy that may help my husband's terrible arthritis. It helps my sinus pain that also makes my teeth ache. So glad you said that, Tina, because it also has a lot to do with the sinuses and headaches. Yeah, sinus pain that makes my teeth ache, that is often Mezarium. My son cracked a tooth and didn't tell me. It developed a large abscess. He herself 6 worked a miracle. You're absolutely right, Melissa from West Michigan. That is, Heap herself is the precise medicine for an abscess. Robin says no more root canals ever. Barb in Milwaukee. What about Myristica? Myristica is also great medicine. Listen, all of these medicines are good, and I don't want to spend time deciphering between the medicines. These are all good medicines. I just want to point out this one in particular because it is such an unusual medicine that we would even think to use it for this kind of a condition. Now I want to read to you some cases. First, let me say this. Mezarium is one of Hahnemann's anti-psoric remedies. Yep, this was one of Hahnemann's medicines. Dr. Samuel Hahnemann. Remember him? He resides in my office. Here he is. He wears a beret because he spent the last 9 years of his life in Paris. Now I'm going to read to you some cases. Geyser, Dr. S.R. Geyser noted the case of a man, 28, who had a violent neuralgia, boring pain in lower left jaw bone, extending to the temple and ear pain. The pain was worse at night. Better from pressure. So when he pressed on it, it helped a little bit. Mezarium 3C relieved it in 2 hours. Thank you very much, Dr. Geyser. Hempel, these are doctors who have submitted their information, noted the case of a toothache in the incisor of a woman. Tooth felt elongated, loose, excessively sensitive with sensation as if being raised out of its socket. Now, my friends, wouldn't that sound like you better run to the dentist ASAP? Upper part of the tooth was excessively painful, but she didn't. She went to Dr. Hempel, who gave her Mezarium 200C, cured in a few hours. So, I am reading from Nature's Materia Medica. It's the 3rd edition of Robin Murphy's Materia Medica. So, my friends, let's see, did I have anything else marked here? No, I think those were the only 2 cases. If you had someone who had suppressed eruptions 10 years ago, 50 years ago, and now they have neuralgia in their jaw, pain at the site of a tooth, and they had that eczema, that skin eruption was most certainly suppressed. You don't think if you go to a dermatologist, the dermatologist is going to say, oh, my dear, do not use an ointment or even an oral medication, because if you do, it will cause trouble later on. They have no idea. They do not know homeopathy. They've not studied it. They know nothing about the organon, the ultimate of the most important information in medicine on earth, as far as I'm concerned. They know nothing of suppression and what will result 10, 20, 30, 40, 50 years later. So if you have someone who's had an eruption, usually it's more extensive than just one eruption. You know, if somebody puts on an item, a garment of some sort, and it makes them itchy, and they go to the dermatologist, and some cortisone cream is used for a week. Maybe they can get away with that if they have a good constitution. But if it's instead eczema is generally chronic. Psoriasis is chronic. That means the person's going to be taking these drugs, using these drugs, smearing these drugs for a very long time. And now, later in life, what comes up is dental neuralgia, a pain around the tooth, on the tooth, in the tooth, etc. Okay, Elizabeth says, if you've had a root canal in the past, should you just have the tooth pulled? Is that your best option? Well, that's what I believe I would do, my friends. But I can't direct someone because it depends on whether or not the person is suffering. In other words, do they have another chronic illness? Do they have an illness that no matter how they try to treat it, it's just not resolving? Root canals can cause trouble that can result in conditions that are long-lasting and remote. So I would get a hold of that book, Root Canal Cover-Up. Jan has reabsorption. Yes, there is that as well. All right, so everybody's helping each other. I love it. What about when the dentist recommends a crown? Well, I'm not wild about crowns either. And I also want to say, friends, but because the teeth are alive. They are alive. They're not dead. Just like the nails are not dead, they're still alive. And to put a crown on a tooth can be problematic in some people. I'm not saying that it's always bad, but I would say that a good measure of prudence might be check with another dentist, a biological dentist. Those are the dentists that are more likely, not always, but more likely to understand the ramifications of using something as a crown or a root canal. I read on Facebook of a case where, with recurring infection in one tooth and a chunk missing in another tooth, took pulsatilla and Merc-Sol and a high potency for months, and the infection cleared and the tooth with missing parts started regrowing. I absolutely believe that to be so. I've talked about regrowing teeth. I think it's not, I shouldn't say regrowing teeth. We cannot repair a cracked tooth. I don't believe homeopathy can do that. But if there's a cavity, and especially if it's in a child, it can be regrown. It can fill in. As an adult, you might get some benefit. Hopefully, it's not so serious a cavity that the cavity is outpacing the ability of the medicine. But yes, Merc-Sol and high potency for months, and the infection cleared. Now, that's really fascinating. I use Hypericum and Arsenicum for infections of the teeth. But yeah, I mean, there's more than one way to bake a biscuit. Whereas Harry says to bake a cat. No, to skin a biscuit. Let's go with that, shall we? Okay, let's see what other folks are saying here. Let's see, people are saying hello from DC. Yeah, Alice, it is a surprise. Mezarium. What about scars for acne? Well, we won't be talking about that today, but I do talk about it in my skin course. Go to Joette's Learning Center, scroll down, find skin, and I do talk about that extensively. We're going to stay here another 3 minutes, and then I'm going to my mighties and answer your questions personally. Have used Hecla lava and Nux moschata during COVID when I would not go to a dentist for a tooth that really bothered me. Used for weeks to really change the dynamic. Worked quite well. Nice job, Diana. Thank you for sharing that. Hecla lava is a great medicine for dental condition, for teeth. And so is Nux moschata. Let's see. Hi from Tauranga, New Zealand, says Gerardine. What dose and how often would you recommend for a dental abscess? I've talked about that. Go to Joette Calabre's Dental Abscess, and you'll find it on my blog. Now, let's talk about Mezarium. What potency are we going to use? Now, it said use it in a low potency, right? That's what I read to you. Dr. Gesser used it in a, what did I say, a 3X? Yes, a 3C. Used it at 3C. And it resolved in a few days. Now, don't expect necessarily, my friends, that it will resolve in 3 days. It depends on the condition. But a 3C could be used, a 200C even. Okay, so you're helping each other. Yes, Alice says, I have Daphne Mezarium shrub in the garden. All parts are poisonous. Yes, my friends, that's what's so phenomenal about homeopathy. We get the most poisonous substances on earth, not I, but the pharmacies, the homeopathic pharmacies, and dilute and succuss and make them into the most extraordinary homeopathic medicines. Okay, what can we do instead of having root canals? It's too hard to say, my friend. It's just it's too involved to be able to answer that so readily. Okay. Yes, Tammy says 200C of Mezarium. But, my friends, see if I would try it in the 3C because good old Geyser says 3C. Now, the Banerjees use 200C. But why not try it in a low potency, right? Why not? All righty. I think we are ready to go to my Joette's Mighty members, and I'll answer your questions. So, yes, you tell me when we can go, Perry.